I'm Etana here at the DailyClout with Dr. Patrick Phillips. Dr. Phillips is a physician from a family doctor from Canada, and he's here to share his COVID horror story with us. Dr. Phillips, thank you so much for being here with us today.
Thank you for having me on, Etana. So yeah, my horror story began in 2020. I think with everything all doctors and the whole world was facing with the onslaught of COVID, I was pretty scared, and we didn't know anything about this virus. And so I was like most other doctors that we were just following the public health protocols because we didn't know anything about it. So we're just going to do what we're told. And I was scared seeing a lot of the propaganda coming out of China with people dying in the streets that we now know was mostly staged. We were very concerned that there was going to be a mass death event. So we took a lot of extra precautions that, looking back, started to make less and less sense as the pandemic went on. As it rolled on and we started entering our third and fourth wave here in Ontario, I started to see a number of things. One is that I wasn't seeing the devastation and full hospitals that they were claiming on the news. Our hospital was almost empty. There was almost no work to do, mostly because people were so afraid. They were too afraid to come into the emergency department. And after that lasted for a while, I started to see the consequences of that. And so we started to see people with these major infections that normally would have come early on in the infection, but then it became like a major life-threatening infection by the time they came in because they were no, not COVID. Sorry, other types of things. We saw very little COVID in my area. We did see it, but it came a lot later. But yeah, I started to see the major harms of things like the lockdowns. Here in Ontario, Canada, pretty much all medical care was switched to telemedicine. So mostly it was phone calls done by family doctors or others, rather than people going in to see their doctors. So I was seeing these kind of horror stories, like patients who had this lump, or what they were saying was back pain, and they were being treated with opioids and everything, and it was all being treated over the phone. By the time they got so bad that they had to come in by ambulance to the emergency department, when I examined their back for what they called was back pain, it was a giant lump on their back. And I put an ultrasound on it, and it was cancer, metastatic cancer, which was horrendous in the sense that if they just had the normal medical care that we had
our whole lives,
right, you would have caught that. The doctor you go in and see your doctor, and they examine you, and you'd be able to catch things like that before they spread and become terminal. So I saw that on multiple occasions, along with devastating mental health effects, especially on children. So I started to see like suicidal children. Like I've seen it before in like teenagers and things, but I was starting to see it in kids like as young as 8. And like, what is going on here? And what I found was it was primarily parents who were following the public health measures. There's a lot of parents that would allow their kids to still see friends and things. But I noticed a big trend on the parents who were scared, were following the recommendations from public health to stay at home, don't visit anybody. A lot of these kids became isolated. They didn't play anymore. They're just stuck in their room for months on end with no school.
Their life was just stripped away from them.
Yeah, they had nothing more to live for. So, and they became suicidal, which prompted their family to bring them into the emergency department. So sometimes I saw them after attempts, or I saw them when their family brought them in and noticed the problems. But it was not normal. Like we're seeing that at much higher rates than we did at any other time. And so
continued until today. Has that continued until today?
I would say it got way better after the lockdowns ended. There's still a mental health crisis for sure. Like people's mental health is not as good as it was before, but it was a major crisis when schools were closed and people were locked in their homes, like with inability to go out, So that's when I noticed it, especially in children. And it was around that time. So this is getting into like December of 2020 that we were just hearing in the media and from the medical organizations here in Canada that Ontario's doctors are calling for harsher lockdowns to stop the spread of COVID. And I'm like, no. First of all, they didn't ask us. There was no survey that was sent around to Ontario's doctors. They just spoke on our behalf. And I knew somebody needs to speak up here. So there were a few doctors here in Ontario who were speaking out against some of these harsh and harmful measures, but very few. And so it was around that time that I kind of made a decision that I need to express myself here. I need to express what I'm seeing.
When during the pandemic was this where you were seeing the horrible effects while they were advocating for more?
Yes, exactly. Yeah. So yeah, this is around December of 2020.
Okay. So like just, the end of the first year.
Yeah, exactly. So yeah, that was one part of it, what I was seeing in the emergency department. The other was that I was seeing as well that all this scientific evidence is coming in and nobody's talking about it. Like, for example, like vitamin D, there were studies showing that people with higher vitamin D levels have drastically lower COVID mortality. So, and that's something that's so simple and easy. Why wouldn't they be advocating for that? But if you advocate for vitamin D, there's just one small example. They call you a quack or a conspiracy theorist. So vitamin D, which is extremely safe, like there's no harm in telling people to take vitamin D, but they would refuse any public messaging around those things. So it got my heckles up, and I knew something is wrong about this. Like they're just trying to, yeah.
Can you give me an example, like when you say they would call us, like obviously I understand what you're trying to say, but like were there concrete examples of you being kind of slandered like this?
Yeah, so absolutely. That's what came after this point. So a few months later, after I started to speak out, is when I got targeted by my medical college. So our college, I don't know if your audience is mostly in the States or Israel, but it's called a medical board in the States, but we call them colleges in Canada. So they're the main medical regulator, the one that gives us our license.
Okay.
They started investigating me and accusing me of spreading misinformation and undermining their public health efforts. And so they started investigating me, and it's, there were a few complaints laid against me, but it was mostly just other doctors. None of my patients complained about me, but it was other doctors who took offense to my opinions. And so, again, like the public health officer in my local town, he actually reported me for my public opinions, like for calling out some of these things and for advocating for public health measures like vitamin D, exercise, sunlight, basic things that research shows lowers your risk of COVID. But what's worse is when the vaccine rollout came out, I started to see some devastating adverse events.
Wow. How early?
So the vaccine rollout started in our area in about March, and in April, I started to see these adverse events. People coming into the emergency department afterwards. I saw some severe neurological deficits, people who got weakness and numbness in their arm. They weren't able to use it. Tinnitus and vertigo, like that impaired their ability to stand. Worsening dementia that caused people to have to be hospitalized, severe fevers, again, leading to hospitalization. So I was required by law to report adverse events to public health here in Canada. But I actually met a significant amount of backlash from that. So my public health officer, who I'm supposed to report it to, and then he's supposed to put it in the database to go to Health Canada, he rejected every single one of my reports.
Based on what?
He said that they don't meet the criteria for an adverse event. So what's interesting is they have this document. So he sent me this document that has these very strict criteria for what they expect as an adverse event. And if it falls outside of those criteria, which are very strict and arbitrary, then it doesn't count, and they won't count it as an adverse event. I'll give you one just example of some of these criteria. So if you have a syncopal episode or fainting after getting the vaccine, it doesn't count unless you get an injury from that fainting. Also, even if you do get an injury from that fainting, it only counts if it's within the first 30 minutes of getting the vaccine. So if it happens after 31 minutes of getting the vaccine and you fall and break a hip or fall and get a head injury, if it happens after 31 minutes, it doesn't count and doesn't go into the database. So
that sounds just about as sensible as the rest of the COVID rules we've been dealing with the last few years. But I mean, honestly, that's just another example of all the absurdity. So they were giving you a hard time submitting these reports. They weren't even allowing you to do what you were legally obligated to do while reporting you for advocating for basic health measures, basic and safe health measures. Okay, absolutely. Now, when patients were coming in with these injuries, were they associating it with the vaccine for the most part, or not at all?
Some of them did, and then some of them didn't. Some weren't sure. I had a regular, like I asked patients just regularly, like if they came in with something new or worsening symptoms, when did you get the vaccine? Because it was just being rolled out in our community around that time. And so Health Canada actually has the criteria that for reporting adverse events, if there's any new or worsening symptoms after taking a pharmaceutical drug, that's considered an adverse event. And so that's the criteria that I was using. But public health has these other criteria that are kind of meant to cover things up. But what I found more concerning was my public health officer, when he rejected these reports, they actually called up those patients and told them that it's not an adverse event, and therefore you should book your appointment to get your next shot, which I was kind of horrified by, because if like, even if it wasn't caused by those vaccines, if there's a good chance that it was, who in their right mind would counsel somebody to get that same,
of course,
intervention? Like, you know what I mean? That's malpractice in my mind, which is what led me actually to stop reporting adverse events after that. Not only because they reported me and they're prosecuting me actually for those adverse events. I'm charged with professional misconduct by my medical college for every single adverse event that I reported. Yeah, so I had to stop reporting them. What's that?
To take us to that story, because that's just beyond egregious.
I know. So what happened is, after I got that letter from my public health officer saying he's rejecting all of my reports, I was very concerned about that. I sent him a letter back saying, tell me why you're rejecting them. Like, just so if there's something wrong on the form, can I fix that so that they're not just being rejected for no reason? I didn't get any reply, but more so I felt really concerned that the adverse event reporting system was compromised. And so I decided to go public. I did an interview with Rebel News here in Canada, and to let people know, like, because a lot of times they're saying, we're not getting any reports of adverse events, so these are completely safe, right?
Right, of course.
We're not telling people that the doctors are sending them in and they're getting rejected, right? So that's why you're seeing so few adverse events like reported in the media. Anyway, he took offense to that, and actually he retaliated for me going public about it and reported me to the medical college. And the medical college latched onto that and has proceeded to charge me with professional misconduct for reporting those events.
That's unbelievable. So when is your next hearing, or what happens next in this case?
Yeah, so my last hearing was on November 23rd. That was where me and 3 other doctors who are charged with similar offenses here in Canada. I mean, there's way more than that. We just kind of lumped together. We have the same lawyer. So we filed a group motion to dismiss our cases to the tribunal. And that was heard on November 23rd. So we'll have to see what happens there. But in general,
on the motion.
There's no ruling yet. No.
Understood. Yeah. Oh my goodness. Yeah. When you, I'm just trying to like collect my thoughts here, because this is just it's another COVID horror story for sure. Are you practicing meanwhile?
No, they suspended my license on May 3rd of this year.
Is there any avenue like for retribution against being falsely charged and having your license suspended and your work suspended?
You can try to appeal to a court, but even if they've acted in bad faith or whatever, they're indemnified in the law, so they're protected from any kind of lawsuits or prosecution. There was one doctor who was the same medical college falsified documents and yet evidence they obstructed justice. He tried to go to the police. They wouldn't take it up. He tried to file a private prosecution, which we can do here in Canada. But it was then quashed and rejected. It was at first accepted by a justice of the peace, but then the attorney general is able to quash it, and that's what they did.
Wow.
So it's very hard to get any kind of retribution. It has to be a political overhaul of the whole system.
Yeah.
The courts are very reluctant to act against the college.
It's so harsh in Canada. Like you expect it to be this Western country with freedoms, and it's just really not turning out that way right now.
No.
The professor, the doctor who reported you to the medical boards, do you have a personal like a personal connection with him? Like you know him in real life on a personal level?
I don't really know him. I'd been in a meeting or two with him at one point. I mean, I have like public health officers are the ones who've controlled our lives over the last year. Like they're the ones that shut down restaurants, kept us locked in our homes and everything. Like so I mean, nothing personal, but obviously it's had a major impact on everybody's lives around here.
Right. It's just hard to wrap our minds around the type of people who can just be so authoritarian kind of towards their own people.
Yeah, I think they see COVID as the only thing that matters, right? So we need to do everything possible to stop COVID, even if it egregiously harms or even kills people. So I think it's just kind of a crusade kind of mentality that often gets a hold of people in power.
For sure. And I kind of feel like we're at this point in time where the power is shifting a little bit, the energy is shifting a little bit. And for so many reasons, kind of the stars are aligning to let information really start pouring out. Are you feeling that in Canada at all while this lawsuit that's obviously absurd is proceeding against you?
Yeah. So I'm noticing a lot among the people. There's a lot more openness among people to these truths and to changing their mind about things. What I'm noticing in Canada, though, in the government, it's very much the opposite. They are cracking down harder now than ever. Often behind the scenes, like the mandates are no longer in place, but any doctor who dissented, anybody who was a leader of freedom movements or whatever, they're coming down, prosecuting them criminally or stripping away their careers. Often behind the scenes, people aren't as much aware of it, but the government is quashing dissent and they're coming down hard. There is a beacon of hope in Alberta. They got a new premier. She's the only premier in Canada that's pro-freedom. It's really a beacon of light. So there is some change there that is hopeful, but the rest of Canada is going the opposite direction.
That's really horrible. And they're cracking down while the public it almost feels like this race in time to see if they're going to gain total control before the people kind of realize what's going on and push back hard enough to, for their control to kind of melt away. And I guess 2023 is going to be pretty wild.
I agree.
Well, thank you so much for sharing your story. If there's anything else you want to share or where people can find you or follow you, and we'll all be rooting for you. And please let me know and reach out when the court comes to a decision about the motion to dismiss.
Sure. Thank you so much for having me on. I do think there's hope. There are things that are changing. I don't think it's coming from the government, but it's coming from the people. Yeah. People can find me for sure on Twitter. I'm back on there after getting banned. It's at Dr. P. Phillips, MD.
Okay. Excellent. Okay. Thank you so much. Thank you for being here. And
take care.
Have a good day.
Okay. All right. Bye-bye.
Hey, everyone. It's Naomi Wolf of DailyClout, and I am asking you to please, if you like the video you just saw, support us, become a member, donate. You can send checks to P.O. Box 24, Millerton, New York, 12546, or go to DailyClout, DailyClout, become a member or donate. Thank you so much for your support. Every penny goes for paying our hardworking staff, paying hosting costs, and paying our lawyers who have been leading the fight to keep you safe and free, to keep the Constitution safe and to keep you free. Thank you so much.